because we know that there is no let-up in the surge of new COVID cases hitting our county of LA County right now. We heard about this drug company Pfizer just announcing early data showing very promising results from their vaccine trials, that it's more than 90% effective. Here to react to what the president-elect just said and what the future looks like is Dr. Suman Radhakrishna, who joins us now. She is the Director of Infection Control at Dignity Health California Hospital. Thank you so much, Doctor, for being here. First of all, I don't know if you had a chance to hear what the president-elect was saying, but one of the things that I think was important to note, and which is a difference from the current president in office right now, is how much he believes the response to the pandemic must be grounded in science. That must be music to your ears.
Yes, and we have been asking people to follow the science, follow the data. So it is really helpful. And before I continue on, thank you for having me on the show. And it's a pleasure to talk to you and all your viewers about how we have now something new to talk about, which will end our restrictions, end our mask wearing, so to speak, hopefully very soon.
Well, and that was the thing that we heard from the president-elect in that briefing there, talking about the number of cases. They're saying, you know, nearly 1,000 American lives being lost to this pandemic a day. And I know that in your hospital, you guys are seeing the increase that we're seeing here in Los Angeles. Talk to us about the hope that you have for this Pfizer vaccine. Are you banking a lot of hope on this one, on these trials?
We are. And, you know, vaccine is that last arm that is going to hopefully boot COVID from our lives forever. So the first thing is to prevent ourselves from getting infected, wear the mask. And vaccines like the Pfizer vaccine, and there's several others in the market that are also in phase 3 trial. And if we can get them all together and people will line up to get the vaccine, then all of a sudden we'll get to a point where everybody is immune, so when the vaccine comes knocking on our individual doors, there's no room for it to get in and nobody gets infected, then wow, COVID's gone.
But of course, that's going to take some time. We heard from Joe Biden, the president-elect, talking about the fact that one of the things they want to make sure of when the vote is finalized and if he takes office as of January 20th, that they have boots on the ground to make sure that if a vaccine is widely available, that the right people are getting it first, right? That's going to be the big question about distribution. Obviously, the primary concern will be the people that are at most risk, which you probably see in your hospital all the time. The most vulnerable, the elderly, the people with pre-existing conditions that might put them at a greater risk for contracting the virus.
I agree. There are people in certain categories that are most at risk. People who are elderly, people who have medical issues, people who are obese, and then the essential workers, because they are, you know, being exposed to other individuals all the time, and you never know who is asymptomatic and shedding the virus and who is not. So all these individuals are most at risk. But at the end of the day, everyone is at risk, and that's what we are trying to tell people. Why would you want to get an infection, even if it means that your demographic, maybe you're 18 years old, so you're less likely to have symptoms? Why would you want to chance it? We already know the mask works. Wear the mask, stay away. I know this Thanksgiving and Christmas is going to be terrible because we're not going to be able to get together, meet our family, and do everything we did before. But if we can just hang in there until an effective vaccine is out, everybody gets vaccinated, then we'll have many more Christmases and Thanksgivings to go to.
I know there still are people that are reluctant about a vaccine. And I was thinking about how when I grew up, it was pretty standard, and even still, and I know there are people that think that they shouldn't be vaccinating their children. That's a whole separate conversation. But we grew up getting vaccinations for diseases that are all but obliterated now. I mean, I think about polio and rubella and those things. I suppose the idea is that this will then be, this COVID-19 will be obliterated because of the vaccine and that there aren't available bodies to be infected.
That's right. That's right. And then once it's obliterated, we don't need to take it again. Otherwise, think about it. The coronavirus antibodies seem to drop. We do have cases of reinfections. So we don't want this to be another recurrent vaccination like influenza or any of the other ones. So if we can all, play our part and get rid of it, it's done. It's gone. I think everybody's tired of talking about it. We need to move on with our
honey,
lives.
we're tired
in
of,
order to
we're
do
tired
that,
of so
hang
many
in there,
things.
do the stuff for the next several months, and hopefully we're done.
So many of us are so tired of so many things, but that's the thing. We have to push through this. What would you say to somebody who says, "Oh, I'm just going to hold off and wait for the vaccine"? What would you say to them?
We're all going to have to wait for the vaccine until it comes.
Well,
But
yes.
while that is happening, we already know some things that work. Make sure you are vaccinated against everything else so that there is no confusion. Influenza plus COVID is a deadly combo, so go get your flu shot. It's still not too late. Make sure you wash your hands. If there is some place you don't have to be physically present, then get on Zoom or Skype and do the work. I get it. We have to go to work. Like I am at work, you are at work, and we're still staying away from each other and taking all the precautions so that we don't infect each other. And if we can keep that going for another several months, and the vaccine is there, then, end of next summer, hopefully, we'll be okay. And I hope what I'm saying is true.
We hope what you're saying is true as well. Dr. Susan Radhakrishna, thank you so much for making time for us. As we navigate this together, it's always good to have expert voices joining our conversation. Thank you.
Thank you.
Stay well.